Okay, and the Cotard syndrome, where it is the nihilism, where you are thinking that this world is gonna end, everything. You're saying everything negatively, negative boomerang. Like, okay. Then the result comes under the delusions. Okay. Then there is a possession defects are like thought. It's everything into the thought insertion. Someone is inserting into the thought delusion. Okay. Then someone is changing your thoughts, like that all comes under possession. Okay. And thought broadcast. Okay. What I'm thinking is known to everyone. Okay. Then sort of form include a derailment. Guys, I forgot to say about this. The circumstance is you are beating around the bush. Okay. One thing you are explaining, but you are going in a way, some other way, and finally finishing there. Okay. That's a circumstantiality. Proximity is you're saying about the thing and you are going anywhere, and you didn't come to back to the point. Okay. So, and derailment is also like that, where initially they can't understand, and like there is a comprehension defect in that, it signifies. Okay. And then loosening of association, where they talks about point and they didn't come back. Okay. Then tangentiality, you are asking a question, they come near to the point but they didn't come to that point, that is tangentiality. Okay. This under comes in the disorders. Okay. Then next thing we're going to see about the personality disorders. Types of personality disorders. There are two types of personality disorders. Um, Three types actually. Cluster A personality, cluster B personality, cluster C personality. This cluster A, they are very strict in everything. Like they are paranoid. They want things to be in there. Then schizoid and schizotypal. Whereas this cluster B person, they are like you, like antisocial. They criminality, they impose, and suicidality, impulsivity, then historic, then narcissistic. This cluster C type of people, they are like avoidant, dependent. They always depend on other personality types. Okay, it comes under type C. This personality test we can do by two tests, namely Rose ink blot test and thematic representation test. Okay. Then let's go and see the what are the defense mechanisms that everyone possesses. Okay. First, mature defense mechanism. Then we'll see narcissistic defense. Then we'll see immature defense. Then we'll see neurotic defense. Okay. First, mature defense. It includes sublimation. You remember SHASH, SAASH, sublimation. Then anticipation. Then altruism. Then suppression and humor. These mature defense mechanisms, everyone is possessing this mature defense mechanism. Uh, okay. Then you'll know about this everything. Okay. Then narcissistic defense is we can know by SPD. S is splitting, and then projection, denial. Okay. Then immature defense mechanism. These will be seen in the psychiatric type of patients. They include regression, then that letting out or putting out something, then passive aggression, then unity defense mechanisms include isolation, isolation effect, displacement, undoing, okay, like those kind of things. Then inhibition, okay. These are the defense mechanisms. Then let us go about see the psychiatric disorders. Okay, main sign is schizophrenia. To diagnose schizophrenia, it should be more than 6 months. It should be there, and it at least contain the following criteria. Also, it contains three the points, and any two should be upper two. Okay, first one is delusion. Second one is hallucination. Third one is disorganized speech. Fourth one is catatonia. Fifth one is negative symptoms. In these three, any two should be there. Okay. Um, this negative symptom include that negatively they are not interested, like not doing anything. That kind of yes, negative symptoms. When you see the um, prognosis of this, if it occurs in some, we'll see good prognosis and bad prognosis. If it occurs in elderly, it's good. Young age, it's bad. uh, Sudden onset, it's good. Insidiously onset is bad. Family history of any mood disorders is good. Family history of psychiatric disorders is very bad. Then if it occurs in females, it's good. In males, it's very bad prognosis. These and all the good and bad prognostic factors. Okay, next we go into see the delusion. The very important thing about delusion and the schizophrenia is, in schizophrenia is the functional abnormality is seen. That is, your functioning is decreased. Okay, whereas in delusion this functioning is preserved. That's the only difference between delusion and schizophrenia. In schizophrenia, to diagnose, it should be at least present 1 month, and there should be no functional loss, as I said. Okay, that's it. Then let's see about the depression. In depression, there should be, to diagnose as depression, there should be depression plus SIGE gaps criteria. This depression is major depression. It should be more than 2 weeks. The SIGE gaps include I don't remember everything, but I will try to remember. S for stress, G for guilt, I for ideal, they do nothing. Okay, and remember other things. I think I didn't remember. Okay, but you can diagnose it. There should be everything negatively is there. Okay, then next one is you should know about the two bipolar disorders. BPD one is nothing but mania plus or minus depression. That is, if a mania is present, the BPD one. BPD two equal to mania plus hypomania. Okay, then now let's see about the postpartum changes. First is the postpartum blues, then postpartum depression, then postpartum psychosis. In postpartum blues, it occurs within uh, 2 days. Okay, within days, 1 to 2 days, where there will be mild depression. Okay, then you just need a reassurance and support. Whereas in postpartum depression, it occurs within weeks. Okay, within weeks, 1 to 2 weeks, there will be moderate depression. Then some okay, treatment is, you can psychotherapy need to use, because then you can start mild antidepressants. Whereas this postpartum psychosis can occur for more than 2 weeks, uh, weeks to months, where there will be hallucinations, delusions, like the Russian properties. So it's the mother is in the infant is at very risk. So the infant should not be present with mother, and the treatment should be we should start antipsychotics. Okay, that's it. Then let's see about the panic attack. A panic attack. What is known as panic attack is it is a sudden fear of impending doom. Okay, then what is a panic disorder? If it present for more than 1 month, is known as panic disorder. It includes features of fear of any additional attack, consequences of the attack, then change in behavior for the fear of the attack, then agoraphobia, where the escape is difficult. This person will not go there. Okay. Now and then let's see about generalized anxiety disorder. Generalized anxiety disorder. In this, there will be anxiety in everything they do, not only particular thing. Anxiety in everything they do. It is present for more than 6 months, at least 6 months. Okay. Then what is phobia is for a particular event there is a fear. I mean, it's also more than 6 months. Then let's see about OCD. OCD is sort of the thought possession. We have seen the starting possession. Okay. Mm, okay. There will be obsession, that is repeated unwanted thoughts going in your head. There is compulsion is the thought will make you to do repetitive movements, the same movements again and again. Okay. Okay, then let's see about PTSD, post traumatic stress disorder. This is due to any life threatening event happened to you or your relative, or when you saw some things, that is known as post traumatic disorder. It will be more than present for more than 1 month. And another disorder is the what is that? One disorder is there, that is a generalized disorder, where any life events will not be there, but it will not last more than 6 months. Okay, this post-traumatic stress disorder. These is everything about the this one. What a psychiatry very important. And last very important thing is you know to read about the timeline of each disorders. Okay, it's very important. Uh, let's see those timeline. This brief psychotic disorder is within 1 month. Okay, then schizophrenia is less than 6 months. Schizophrenia is more than 6 months. You can remember by within 1 month, then 1 to 6 months, then more than 6 months schizophrenia. Then you see the psychotic schizophrenia and schizophrenia. Then let's see about the depression. Hypomania is less than 4 days. Okay, then mania, bipolar mania is less than 1 week. Major depression more than 2 weeks. Okay, this dysthymic means This depression present more than 2 years is dysthymic. Then the cyclothemic is depression more than 2 years is cyclothemic. Okay. Remember 4 days, 1 week, 2 week. On 4 days is hypomania. This is mania. This is depression. Okay. HMD. Remember. Okay. Then let's see what this acute stress is very less than 1 month. Okay. This post traumatic is more than 1 month it will persist. Then the panic disorder is more than 1 month. This is adjustment. I said no. This adjustment syndrome. That no life event, but it settles in 6 months is this adjustment syndrome. Whereas this generalized anxiety and phobia are more than 6 months. Okay. Here OCD is less than is 2 weeks. Okay. Then it means OCD 2 weeks. Then acute stress within a month. Then panic and PTSD is more than 1 month. Then within 6 months adjustment disorder, more than 6 months is phobia and generalized anxiety. Okay, it's there. Okay, then delusion is more than 1 month. Depression 2 weeks is in there. Then persistent depression 2 years is the cyclothemia or dysthymia. Then by mania is 1 week. Hypomania 4 days. OCD 2 weeks is in there. Then panic disorder is 1 month. Generalized anxiety phobia 6 months. Acute stress reactions is in 1 month. PTSD more than 1 month. Adjustment disorder is in 6 months. ADHD is more than this. ADHD is very important. ADHD is where they are very restlessness. They can't concentrate on some things. Okay, so remember the formula 6 into 12 equal to 6 into 2 equal to 12. 6 months in 2 sittings. Okay, you should know it is that within 12 years is known as ADHD. Okay, let's go and see about the